Okay, so adult immunization in India. There's just so much information out there. It's kind of overwhelming, right?
Yeah.
Especially with guidelines from like all these different medical associations.
Yeah, it can definitely feel like a lot to process.
But don't worry, because today we're going deep on something pretty major, the Indian Consensus Guideline on adult immunization.
This is really exciting stuff.
Yeah.
Um, you have 13 major medical organizations. Everybody from the Cardiological Society of India to the Infectious Diseases Society, all collaborating.
Wow.
Yeah, to create this unified, standardized approach to adult immunization in India.
Yeah.
Huge.
Yeah.
It's a real landmark moment, I think, for Indian healthcare.
Absolutely. And just imagine the impact if this actually leads to like adult immunization being included in India's universal immunization program.
Oh, that would be a game changer. Public health revolution.
Absolutely. But before we get too far ahead of ourselves, why IS adult immunization such a big deal?
Well, for starters, Indians are living longer now, which is fantastic, of course, but it also means we have a much larger elderly population, and they're more vulnerable to, all sorts of vaccine-preventable diseases.
Right, right.
And then you add to that the rising rates of what we call lifestyle diseases, diabetes, heart disease.
Oh, yeah.
And suddenly these infections that, maybe wouldn't have been as big of a deal before can really hit people hard.
So it's not just about like individual health, right? We're talking about the overall well-being of India, a healthy workforce, strong economy, it's all connected.
Exactly. A healthy population is a productive population.
Yeah.
So, rather than just going through like a basic types of vaccines rundown,
Yeah.
let's look at how different vaccine technologies are actually being used in adult immunization based on this guideline. For example, you have what are called recombinant vaccines, like the hepatitis B vaccine.
Right. They use just a specific piece of the virus, like created through genetic engineering.
Exactly.
And it gives the immune system this like targeted workout.
Targeted workout, that's a great way to put it.
I like it.
Then there are the live attenuated vaccines,
Yeah.
the chickenpox vaccine, for example. That uses a weakened version of the actual virus to trigger immunity.
Oh, okay.
And then you have the inactivated vaccines, like the one for polio, which uses a killed version of the virus.
Right, right, right.
And then the toxoid vaccines, like the one for tetanus, right?
Yeah.
That uses a harmless version of the toxin produced by the bacteria.
Oh, wow.
So different approaches for, different bugs, different viruses. Pretty fascinating.
It really is. Now, this guideline gets like pretty specific with its recommendations, right?
Yeah,
It considers both risk conditions and age groups.
it does.
So let's start with the risk conditions, and specifically chronic diseases. We're talking about a huge segment of the population in India dealing with diabetes, heart disease, lung conditions, kidney problems, liver disease, even alcoholism. It really kind of paints a picture of how these lifestyle changes and rapidly growing middle class are really impacting health in India.
Absolutely. We're seeing those trends reflected in these guidelines. It's not shying away from these realities.
Yeah.
For this group, the guideline universally recommends vaccines like Tdap. That's for tetanus, diphtheria, and pertussis. And the flu shot, of course. Really all about providing that extra layer of protection when their immune systems are already, kind of facing challenges.
It makes sense, like bolster their defenses.
Exactly. Bolster the defenses. Now, it's not, just blanket recommendations for everybody. The guideline really digs into specific risk factors within each condition.
I see.
So for example, you have chronic liver disease, and you're planning a trip to, I don't know, maybe Southeast Asia, where hepatitis A is, pretty common.
Right.
That's when the hepatitis A vaccine comes into play.
Yeah.
So, targeted approach.
Sure.
Based on your individual needs, circumstances, really smart stuff.
That's where the power of this guideline really kind of shines through, right? Like it's not one size fits all.
Not at all.
So what about people who are immunocompromised?
Right.
We're talking about individuals with HIV, cancer, or those who've had organ transplants.
Right. This is a particularly vulnerable group. So the recommendations here are, very carefully tailored to their needs. Tdap and flu vaccines are still, universally recommended. But you also see a strong emphasis on pneumococcal vaccines.
I see.
Yeah.
Because even like a simple ear infection could become really serious for someone who is immunocompromised.
Exactly. And this
Yeah.
is where we also see the guideline really taking into account the specific challenges of, healthcare access in India.
Oh.
Pneumococcal infections can be very dangerous in areas with limited access to healthcare.
Yeah.
So, providing this protection early on is really crucial.
It's like creating a safety net, I guess, for those who are most vulnerable.
Yeah, that's a good way to think about it. A safety net.
Now, before we dive into the age-specific recommendations, something interesting I noticed was that the guideline addresses the HPV vaccine,
Yes,
but I know there can be like variations in recommendations from different organizations.
absolutely. That's a great point. So while, the consensus on the HPV vaccine itself is very strong, the recommended age ranges can differ slightly.
I see.
And it, really highlights how, medical knowledge is constantly evolving. And
Yeah.
it's so important to have those personalized consultations with your doctor.
That's a good point. This deep dives about, giving you the key information, empowering you to have those conversations,
Yeah.
About your own specific needs and concerns with your healthcare provider.
Absolutely. It's about taking charge of your health.
Yeah. Okay. So with that in mind, let's move on to those age-specific recommendations, starting with young adults, 18 to 26.
Right. So this is a really important time to catch up on any missed childhood vaccines.
Okay.
Think MMR, chickenpox,
Right.
maybe even hepatitis B.
Right.
It's really about closing those immunity gaps before they become a problem.
Like giving their immune systems a second chance.
Yeah, exactly. A second chance to get it right. And for women in this age group, the guideline very strongly recommends the HPV vaccine. It's such a powerful tool against cervical cancer.
Right. Now, as we move into the 27 to 49 age group, those booster shots start to really take center stage, right?
They do. That Tdap booster every 10 years
Yeah.
becomes especially important.
Okay.
And of course, the annual flu shot remains a top priority.
Yeah, it's like routine maintenance for your
Seriously.
immune system, right?
Yeah.
Keeping those defenses up as you deal with all the challenges of adult life.
I like that. Routine maintenance, yeah. But then things get even more interesting as we enter the 50 to 64 age group.
They do, don't they?
They do.
Yeah.
That's when the shingles vaccine comes onto the scene.
Oh, right.
Shingles can be so painful, so debilitating, and it tends to hit harder as we age. So this recommendation really reflects a much more proactive approach to protecting older adults, anticipating those vulnerabilities.
Trying to get ahead of it.
Exactly.
Yeah. Speaking of which, let's talk about the 65 and over crowd.
Right. So for this group, we see all the previous recommendations, carrying forward, but there's also a recommendation for a higher dose flu shot for that extra protection.
I see.
And remember those pneumococcal vaccines?
Yeah.
They're even more crucial now because the risk of pneumococcal infections it keeps increasing as we age.
So it's like as we get older, the focus really shifts to maintaining those defenses and preventing, those infections that can hit us harder in those later years.
Exactly. Now, while we're on the topic of looking ahead, let's take a moment to think about some of the exciting developments on the horizon. Newer vaccines like the dengue vaccine and the RSV vaccine hold huge, I think, potential for improving, adult health in India.
Oh, this is where I get really excited. It's like a glimpse into the future of preventive healthcare. Tell me more. Tell me more about these game changers.
Well, imagine, right, a future where dengue fever, a major, major health concern in India, becomes, significantly less of a threat.
Wow.
That is the potential impact of, the dengue vaccine currently undergoing trials here.
Oh, I remember reading about those trials. It does feel like a huge step forward,
Yeah.
especially, given how widespread dengue is in India.
It is. And then there's the RSV vaccine, respiratory syncytial virus, or RSV, it's actually a very common respiratory virus, but it often flies under the radar. But, it can be quite serious,
Yeah.
especially for, infants and older adults.
Right, right. Speaking of older adults, let's not forget about those, unique recommendations for travel and mass gatherings.
Right. These are situations where we need to be, extra vigilant.
Yeah.
Travelers, especially those going to, regions with specific health risks, need to be proactive.
Absolutely.
Like, for instance, if you're traveling to certain parts of Africa, the yellow fever vaccine is a must.
Right.
It's non-negotiable. And then for, pilgrims going to the Hajj, the meningococcal vaccine is absolutely essential.
It's like a travel checklist, for your health. Just making sure you're equipped to handle those, the challenges of different environments and
I
situations.
like that. A travel checklist. I like that.
I try.
And speaking of specific environments, we can't forget about those mass gatherings within India, like
Yeah.
the Kumela.
Right. Yeah.
These events bring, their own unique health risks just because of the sheer number of people in such close proximity.
Oh, absolutely. The guideline recommends vaccines like typhoid, Hep A, and even Japanese encephalitis for attendees, especially, if they're going to be there for a while.
Yeah, it comes down to understanding the potential risks
Yeah.
and taking those extra precautions. Now, before we wrap up for today, let's circle back to the Indian consensus guideline on adult immunization itself. What are some of the key takeaways you think our listeners should really remember?
Well, I think for me, it's the realization that adult vaccination isn't just about, getting a booster shot here and there. It's
Wow.
it's a dynamic and personalized approach to protecting your health, like throughout your life.
It's about taking charge of your health destiny,
Yeah.
right? And this guideline really provides like a roadmap for navigating this complex landscape. It's the culmination of, years of research and collaboration from some of the brightest minds in Indian healthcare, all working towards, a common goal, a healthier India.
Absolutely. So this deep dive, it's given you the essentials.
Right.
But what questions, does this spark for you? What aspects of your health or your lifestyle, warrant further exploration?
That's a great question. This is where, critical thinking comes in. Don't just passively absorb this information. Apply it to your own life.
Right.
Consider your own individual risk factors, your travel plans, your, overall health goals.
Yeah, it's about having those informed conversations with your doctor, making decisions that align with your own individual needs.
Exactly. Now, here's something that might surprise you. This guideline doesn't just focus on what we traditionally think of as, adult vaccines.
Yeah.
It also touches on two vaccines we often associate with childhood rotavirus and BCG.
That is interesting. I always thought those were like exclusively for kids. What's the thinking there?
Well, emerging evidence suggests that these vaccines could benefit certain high-risk adult populations as well.
Yeah, I see.
Like, for instance, take the rotavirus vaccine. It could actually be really beneficial for immunocompromised adults, older adults, and those with underlying health conditions, people who are more vulnerable to severe gastroenteritis.
Makes sense, providing that extra layer of protection for people whose immune systems might not be as robust. What about BCG?
So BCG is primarily used to protect against tuberculosis, right?
Right.
But the guideline actually suggests that it could be beneficial for healthcare workers, people with HIV, and those living in areas with a high prevalence of TB.
So it's all about like strategically targeting those who are, most vulnerable or face, a greater risk of exposure.
Oh, yes.
It seems like the world of adult immunization is becoming like more nuanced, more personalized.
Oh, absolutely. It's moving away from that, that one-size-fits-all approach towards, a more tailored strategy that really recognizes those individual needs and risk factors.
Yeah.
Which is a positive development for sure.
Absolutely. And this Indian consensus guideline on adult immunization really is a testament to that evolution, right?
It is.
Bringing together all these diverse, medical perspectives to create this comprehensive and unified approach.
It's such a powerful example of, collaboration in healthcare.
Yeah.
And by working together, these organizations have, created such a valuable resource that can really make a difference in the lives of, countless adults in India.
Absolutely. So as we wrap up this part of our deep dive, I'm curious, what stands out to you the most about adult immunization? What surprised you or sparked your curiosity?
Honestly, just the sheer scope of it all. It's not just about those, few booster shots we often think of.
Right.
There's a whole world of preventive health care that, many adults are just simply unaware of.
It's true. It's a reminder that, learning is a lifelong journey, especially when it comes to our health. And knowledge is power.
Yes.
Armed with, the insights from this consensus guideline, you can have much more, informed conversations with your healthcare providers and really advocate for your own health.
It's about making, empowered decisions about your immunization journey and taking proactive steps towards, a healthier future.
Absolutely. So until next time, stay curious and stay protected.
Stay protected. It's about protecting yourself, right? But it's also about protecting, the people around you.
Absolutely.
Your family, your community. It's a collective responsibility.
And speaking of responsibility, this guideline doesn't shy away from addressing some sensitive topics like alcoholism.
Oh yeah, that's a really important point. Excessive alcohol consumption can really weaken the immune system.
Right.
And it makes people more susceptible to, all sorts of infections. So the guideline actually specifically recommends, the pneumococcal and hepatitis B vaccines for individuals who struggle with alcohol abuse.
It's like they're acknowledging that, these are real issues that people are facing, and they're providing guidance on, how to mitigate those risks.
Exactly. It's about meeting people where they are and providing them with, the tools they need to protect their health, no matter what their circumstances may be.
It's a very compassionate approach, and it speaks to the holistic nature of this guideline. It's not just about listing vaccines. It's about understanding the complexities of people's lives and providing guidance that's relevant and accessible.
Absolutely. One of the things I really appreciate about this guideline is that it acknowledges that, healthcare is not one size fits all. What works for one person might not work for another. And that's why it's so important to have, those open and honest conversations with your healthcare provider.
It's about finding that personalized approach, right? That really caters to your individual needs and risk factors.
Exactly. Personalized medicine. That's the future of healthcare.
Yeah.
And this guideline is, it's a step in the right direction.
Absolutely. Now, before we move on, I did want to touch on something that, we often associate with childhood vaccinations, but it's actually addressed in this guideline for adults as well.
Oh, interesting. Which one is that?
The MMR vaccine.
Yeah.
Measles, mumps, and rubella.
Right. We typically think of that as a childhood vaccine.
Yeah, yeah.
But not everyone receives it during childhood.
Right.
And even those who do, might not have developed full immunity. So the guideline actually recommends, catching up on the MMR vaccine, for adults who may have missed it or who are, at higher risk, like healthcare workers, for example.
It's another example of how this guideline is really trying to, fill those immunity gaps. Regardless of, age or background, it's about ensuring that everyone has the opportunity to be protected.
Absolutely. And it also highlights the fact that immunity isn't always, a one and done thing.
Oh, right.
Sometimes we need those boosters to, keep our defenses strong.
Yeah.
Especially as we age.
Now, this might be a good time to shift gears a little bit.
Okay.
And talk about something that I know a lot of our listeners are probably curious about. Travel vaccinations.
Ah, yes. Travel vaccinations. Such an important topic, especially, for a country like India.
Yeah.
With so much, travel, both domestic and international.
Absolutely. And this guideline actually has a whole section dedicated to travel recommendations.
Yeah.
So let's break it down a little bit. First of all, what are some of the key things that travelers should keep in mind when it comes to vaccinations?
Well, the most important thing is to, plan ahead. Don't wait until the last minute.
Right.
Some vaccines require multiple doses or, take time to become fully effective. So, start researching and consulting with your healthcare provider, at least 6 to 8 weeks before your trip.
That's a good rule of thumb, 6 to 8 weeks. I like it.
Yeah.
Now, the recommendations obviously vary depending on the destination, right?
Absolutely. Certain countries have, specific health risks that require certain vaccinations.
Right.
For example, if you're traveling to sub-Saharan Africa, the yellow fever vaccine is mandatory.
Absolutely.
And then, other destinations might have, risks of typhoid or hepatitis A.
And it's not just about, where you're going, but also what you're doing there. Right?
Yeah, absolutely. Your activities and the length of your stay can also influence the recommendations.
Okay. So let's say, for example, someone is planning a trip to Southeast Asia. What are some of the vaccines they might want to consider?
Well, in addition to the routine vaccines like, Tdap and flu,
Yeah.
they should definitely consider, hepatitis A,
Yeah.
typhoid, um, and possibly Japanese encephalitis, especially if they're, spending time in rural areas.
Right. Right. Now, I know that, India has a lot of religious pilgrimages and mass gatherings.
You do.
So what are the specific recommendations for those types of events?
Well, those can be tricky because you have, large crowds of people, um, often from different parts of the country or even the world,
Right.
coming together in close proximity. So, the risk of infectious diseases spreading is definitely higher. So the guideline actually recommends, vaccines like meningococcal, for events like the Hajj pilgrimage, and for large gatherings within India, like the Kumbh Mela, for instance.
Right.
Vaccines like typhoid and hepatitis A are strongly encouraged.
So it's really about being aware of, the potential risks and taking those extra precautions.
Exactly. And that's why it's so important to consult with your doctor or a travel health specialist to get personalized advice based on, your individual itinerary, your health history,
Yeah.
all those factors.
Because every journey is different, right?
It is. Every journey is unique, and so are your health needs.
Now, I know we've covered a lot of ground today. Is there anything else that you think our listeners should really take away from this discussion on the Indian Consensus Guideline on adult immunization?
I think the key message is that adult immunization is not just about, a few booster shots.
Right.
It's about a comprehensive approach to protecting your health
Yeah.
throughout your life.
It's a lifelong journey.
It is.
And it requires, active participation, ongoing learning, and really that open dialogue with your healthcare provider.
Exactly. It's about being informed, being proactive,
Yeah.
and really taking ownership of your health destiny.
It's empowering, isn't it?
It is.
To know that we have the knowledge and the tools to protect ourselves and the people we love.
Absolutely. Knowledge is power.
I like that. Knowledge is power. So until next time, stay curious, stay informed, and stay protected. It's fascinating to see how these recommendations really do take into account the specific context of India,
Oh, absolutely.
Yeah.
We're a country with such a diverse population.
Mm-hmm.
Different regions, different cultural practices, different socioeconomic backgrounds.
Right.
And all of those factors play a role in shaping the health landscape. So it's really impressive to see a guideline that recognizes that complexity and offers such tailored guidance.
It's really a testament to the expertise and the dedication of the medical professionals who put this together. They're really taking a holistic approach to adult health.
They are. And it's not just about preventing diseases,
Mm-hmm.
It's about promoting overall well-being, helping people live longer, healthier, and more fulfilling lives. And that's something I think we can all get behind.
Absolutely. It's empowering, isn't it, to know that we have this knowledge, these
Yeah.
tools to really take control of our health destiny.
I think so, yeah. And this guideline is a great starting point. It's a roadmap
Yeah.
to help us navigate this complex landscape of adult immunization. But it's just the beginning, right? The real journey starts when we take this information and we apply it to our own lives.
Right. We talk to our doctors, we ask questions, we make informed decisions that are right for us.
Exactly. It's about being proactive.
Yeah.
And really advocating for our own health.
It strikes me that this whole conversation about adult immunization is really a conversation about taking responsibility.
It is. It's
Yeah.
about recognizing that our health is not just something that happens to us.
Yeah.
It's something that we have a role in shaping.
Mhm.
We have choices. We have agency. And this guideline is, it's giving us the information we need to make those choices wisely.
And it's not just about ourselves, right? It's about the people around us, our
Yeah.
families, our communities.
Exactly. When we protect ourselves, we're also protecting the people we care about. It's a ripple effect.
I like that, a ripple effect.
Yeah.
So as we wrap up this deep dive, I want to leave our listeners with a thought. Think about, the people in your life, your
Yeah.
parents, your grandparents, your friends.
Yeah.
How can this knowledge about adult immunization help you, make a difference in their lives?
That's a great question.
Mm.
Maybe it sparks a conversation. about their vaccine history.
Hmm.
Or maybe it encourages them to, schedule a checkup and discuss their individual needs with their doctor. It could even, inspire them to learn more about the vaccines that are, relevant to their age and their health status.
It's about sharing this knowledge, and empowering those around us to make informed decisions about their health.
Absolutely. It's never too late to, prioritize well-being.
And remember, it's not just about living longer, it's about living better.
Well said. So until next time, stay curious, stay informed, and most importantly, stay protected.
Stay protected.